Let's start with the state of women's health in South Africa and why prevention needs to start at a very young age.
Thanks, Rofhiwa. I mean, women certainly at every age and every stage of life have health conditions which can be prevented largely. Women's health is worsening in the country. Non-communicable diseases, especially like diabetes, is on the rise. It's the leading cause of death amongst women. And, part of this is obesity. So stats show that about 2/3 of women are obese or overweight. And this has repercussions on, and risk factors for other illnesses like diabetes, hypertension, and some cancers. You mentioned HPV, you mentioned cervical cancer, and breast and cervical cancer are both amongst the top 5 cancers that women suffer from. And there are processes to roll out HPV vaccines, and a regular pap smear screening can decrease cervical cancer's incidence and mortality by like 80%. So these are preventable measures that women can partake in and participate in, and both medical schemes and the state can support.
Let's talk about screenings a little bit more in depth, Heidi. And when we look at some communities, that is not very accessible. And I just want to get a sense of the implications of the fact that there is a lack of access for things like screenings in certain communities.
So I think you're absolutely right. I think that there are barriers to access, and I think that cost, transport to the clinic, healthcare professionals, those are all barriers to access for screening. But I do know that the Department of Health have rolled out HPV vaccines to school children, which is a very positive step.